Namaskar, I am Dr. Rajesh Jindal. I am a medical oncologist attached to Rabindranath Tagore Hospital, West Bank Hospital and to Woodlands. I treat my patients with anti-cancer drugs, which is also called chemotherapy. In this session, I would want to discuss a little bit about lung cancer. Lung cancer, as we all know, is a major health problem in our country and especially in Calcutta. Lung cancer is caused by the proliferation or the growth of abnormal cells in the lung, which ultimately lead to the formation of a tumor or maybe a cancer, which will ultimately lead to the death of the patient. What are the reasons why should a patient have or anybody have lung cancer? Studies have shown that a large number of lung cancers, or rather 85% of all the lung cancers, are caused due to smoking. All lung cancers may not be due to smoking, but then the large majority are due to smoking. Even people who have not smoked all their lives, they may have inhaled secondhand smoke or smoke which comes from other people smoking in their vicinity or in their home. That might also lead to lung cancer in these people. Now comes the question of the symptoms how can we know the symptoms or what exactly are the symptoms of lung cancer? Unfortunately, lung cancer in some cases, even in advanced stages, may not have any symptoms. The other symptoms which may be there for lung cancer are, it may be cough, shortness of breath, the patient might get blood in his sputum, loss of weight, unexplained loss of appetite, pains here and there, or it might be he might have symptoms when the disease is actually spread into the other parts of the body, which might have symptoms in the brain, or he might have symptoms of aches and pains if the skeleton is also involved, if the various bones are also involved. What are the steps in diagnosis? The first step which we need to do is to obtain a FNA sample or maybe a biopsy from the tumor. A biopsy is recommended rather than an FNA because it gives us a lot of valuable information according to which we can treat the tumor. After the biopsy, we need to stage the tumor. Staging means how extensive is the disease in the body. We may have to do various kinds of blood tests and also radiological evaluations like CT scan of the abdomen, CT scan of the chest, CT of the brain, or maybe a PET CT. How is lung cancer treated? Most people would often ask me, Doc, what do I do next if I have lung cancer, but then what do I do next? Well, in the early stages, we can treat it with surgery. That would be for stage 1. But anything beyond that, surgery is a choice, but then anything beyond surgery, if the disease has spread beyond the confines of the lung, or if the patient is not operable for any other reason, then the choice becomes either radiotherapy or the use of anti-cancer drugs, which is chemotherapy. We might have to use a combination of either 2 or 3. Or these days we've got new drugs also, which are called the TKIs or the monoclonal antibodies. A combination of all these drugs, surgery and radiotherapy, will give us good efficacious treatment for the patients of lung cancer. How can lung cancer be prevented? Well, as far as in the light of present knowledge and studies, there is practically no way in which we can prevent lung cancer except smoking. So if we can inspire our people not to smoke, it will go a long way in reducing the incidence of lung cancer. Besides this, there is a trend towards spiral CT of the lung, and especially in smokers, which helps to detect lung cancer in its early stages in patients who are at a risk for having lung cancer, which may be smokers, people who are exposed to asbestos, or people who are exposed to radon gas during their occupation. What are the different kinds of lung cancer? Well, lung cancer is mainly of two types. Either it is the small cell variety or it is the non-small cell variety. Thank you.